Studies have shown that men are 3 times more likely to die by suicide, 3 times more likely to become dependent on alcohol and drug use, 1.5 times more likely to be victims of a violent crime, and 36% of adults seeking help in mental health programs in the UK and USA are men. Mentally, our men need more attention, and today we are going to talk about it.
Stress when it gets hard. Gotta let go, let God. Gotta let go, let God, yeah. Don't stress when it gets hard. Gotta let go, let God. Gotta let go, let God.
Hi there, welcome to my channel, 𝐁𝐿𝐴𝐻𝐿. I'm Kim, also known as Dr. Goodtoall, and on my channel I explore health, a lifestyle, and a ton of Jesus. This and every Wednesday for the month of June, we will be discussing everything men's health for Men's Health Awareness Month. Last month was Mental Health Awareness Month, and it's only right to start this month's first Men's Health Wednesday with mental health. Mental health is not synonymous with psychosis, or as my people call it, madness. That is just a stigma that needs to end now. It is making things so much worse for our loved ones, neighbors, daddy, uncle, brother, colleagues, yeah. But you never know, so those statistics I mentioned earlier also applied to them. Just as the organ, the eye, can have ailments that range from cataracts, blurry vision, and even to a further extent blindness, so does the organs, the brain, where mental health derives from, have conditions that vary. And these include mood disorders such as depression and bipolar disorder, anxiety disorders, personality disorders such as paranoias or borderline personality disorders, psychotic disorders such as schizophrenia, eating disorders, trauma-related disorders like PTSD, and lastly, substance abuse or addictive disorders, which include drug and alcohol abuse, and even sexual addiction can fall under this category. So, as you can see, there's a lot more to mental health than psychosis or madness. And now that we have gotten that out of the way, let's zone in on today's topic of depression and anxiety in men. I couple these together because more times than none, depression disorders are accompanied by anxiety disorders. So let us address the elephant in the room. Men don't really talk about mental health. Can we just be honest? I mean, not every single man, we can't just put a blanket over everybody, but there are a good chunk of men that just don't want to talk about it, and I think we should address why. And first things first, I believe societal expectations and traditional gender roles play a huge role on why men are less likely to discuss or seek help for their mental health problems. These stigmas damage men too. You know, the ones where man must be tough and shouldn't bawl and those things. Yeah, men shouldn't cry. Men should always have it together. They shouldn't have emotions. Yeah. Both men and women, boys and girls, play a role in those stigmas. With the "what I cry for," or "what are you crying for?" "Girl, clown, idiot, sissy, simp, am I in your house?" When a man is seen expressing genuine care or brokenness, these are some of the terms that are used to judge and degrade him. And it genuinely breaks my heart to see males and females discourage men the way so many of us do when they love or get excited about simple things, cry or express themselves. And ever so often, these emotions are just bottled up like a cup filled to maximum capacity, and then it explodes and turns into rage, irrational thinking, and most commonly numbness. They don't feel anything. So many humans, not just men, are numb. And I must add that none of this makes any of the effects of mismanaged or disregarded mental issues right or justified, but it does really emphasize the need for us to be having this talk to minimize the occurrence of these effects of rage and other effects that can be quite detrimental. Secondly, men are often expected to be the breadwinners. and to be strong, dominant, and in control. While these things aren't inherently bad things, they can make it harder for men to reach out for help and open up, especially because many don't seem to realize having an understanding of your emotions and knowing that they're there, processing them, interpreting them, relaying them, illustrates dominance, strength, and being in control, not having any emotions at all, right? And I can't speak for anyone else, but one thing I love to see in a male is his ability to know, understand, and express his feelings, even if it involves tears or going around in circles to get it out. Get it out. I always tell the people around me, emotions are like farts. They are better out than in. Trust me, because when the gas reach up your so it don't feel nice. Emotions were made to inform us of what's on the inside of us, not control us, not enchain us in darkness. Being able to know and express what you are feeling in a safe place is shining light on it, and there is freedom in light. Thirdly, men who can't speak openly about their emotions may genuinely think that what they're going through is a normal way of living because so many other people are living that way. Let me just add, just because the world is in darkness doesn't mean you have to be, all right? Fourthly, men who can't speak openly about their emotions can be less able to recognize symptoms of mental health problems in themselves, either because they are afraid of even considering the reality that something may be wrong and less likely to reach out for support, or they genuinely have no idea what the symptoms really are. So, what are the symptoms of depression and anxiety? I'll start off by saying that there isn't a difference between the symptoms of depression and anxiety present in men and women. They vary for both men and women, right? So, symptoms of depression include change in sleeping habits, difficulty concentrating, fatigue even with sufficient rest, loss of interest in things that you normally do or like to do, a decreased appetite, irritability accompanied by anger, tolerance levels are usually low, physical pain without a known cause, sexual dysfunction, digestive complications, usually caused by poor diet choices, anxiety, and suicidal thoughts. So those summarize the symptoms quite clearly. And speaking of anxiety, the symptoms of anxiety disorder include increased quantity and intensity of worrying, difficulty sleeping and restlessness, concentration issues, irritability and tension, indecisiveness, sweating, hot flashes, trembling and shaking, chest pains and shortness of breath, feelings of terror or impending doom. And I really do want to mention that there are a variety of anxiety disorders, such as generalized anxiety disorder, panic disorder, social anxiety, and specific phobias, just to name a few. But these symptoms are a general list, mainly associated with generalized anxiety disorder, but can be applied to the variety of the types of anxiety. So now we reach the meat of this discussion, where I really want to reach out to the men. If you're experiencing multiple of these symptoms, I want to encourage you with this truth. You are still worthy to be loved, and you are adequate, and you are not alone. If you are worried about your mental health, there are some ways to overcome. Firstly, talking about your feelings. Talking about your feelings can help you deal with times when you feel troubled. Establishing a relationship that is good for your mental health, or people that allow you to truly be yourself in a non-judgmental environment is key, right? There are some instances where just talking to a friend isn't enough though, and you need professional help in finding a solution, and that is okay. I encourage you to do just that. It's important to understand that the average person isn't a professional counselor. So I have added a few places to seek help, just in case you genuinely aren't even sure where to begin and you don't have a safe place to talk, or you've tried your safe places, but you're not really getting to a solution and you genuinely need some help. Second tip I have for you is just keep active. Regular exercise can boost your self-esteem and can really help you concentrate, right? Get some sleep and feel better. Exercise keeps the brain and your other vital organs quite healthy. And it's also a significant benefit towards improving your mental health because it gets those serotonin levels up and running and balancing out everything, right? The endorphins that help you to feel good. Yeah, when you release those endorphins, trust me, that really, really helps to keep your mind at ease and to help you feel good. Not to mention, you get those muscles. Point number 3, asking for help. Now, none of us are superhuman. We all sometimes get tired or overwhelmed by how we feel or when things don't go to plan. If things are getting too much for you and you feel you can't cope, ask for help. Your family or friends may be able to offer practical help or even a listening ear, okay? Because sometimes you really just need someone to listen to you and the answers are on the inside, right? There are also tons of local services that are there to help you. So again, I will definitely be adding that in my description box below, okay? 4th tip, eating balanced meals. Now, your brain needs a mix of nutrients in order to stay healthy and function well, just like the other organs in your body. A diet that's good for your physical health is also good for your mental health. Drink that water, eat your vegetables, eat your fruit, okay? Point number 5, do something you're good at. What do you love doing? What do you enjoy? What activities can you get lost in? What did you love doing in the past? Enjoying yourself can help beat stress. Doing an activity you enjoy probably means you're good at it. And achieving something boosts your self-esteem really and truly. Like when you do something really good, it can really help. But remember, choose the non-toxic things, all right? So we're not talking about alcohol. We're not talking about excessive partying. We're not talking about drinking. We're not talking about sex, all right? It's so important to find healthy things to do that doesn't compromise your overall well-being. Because remember, if your overall well-being is compromised, so is your mental health. So you'll find that you're in a perpetual cycle of just trying to find joy because you're sabotaging yourself. So it's really important to be mindful about what you partake in and how much of that you do. Sometimes what you're good at is helping others. So even if it is, volunteering at your local church or volunteering at a home or volunteering, helping your grandmother, or something that helps you to feel like you're doing something, that you're helping someone, that you have a place, also can really help get your mood up. It's important, however, to know what your boundaries are and to really know just because you have boundaries doesn't make you a bad person. So if you can't right now, that's okay. If you're not available emotionally and mentally, that's okay. Try your best to communicate that and not beat yourself up about not being available. Now, the flip side of men and mental health and anyone with mental health is the persons that are worried about someone's mental health and how you can help them. I have some tips here I would love to share with you, because if we can target both the persons who are suffering and the persons dealing with those who are suffering, then overall we can go in a positive trajectory in the future. The first point is letting the person know that you're there to listen to them without judgment. Your genuine, non-judgmental, open-hearted presence. Secondly, someone who is experiencing mental health problems may find it very hard to reach out. So try to keep in touch. Noting boundaries. A text message or a phone call could make a big difference if they want you to. Find out about local services, as in the description box below, such as talking therapy or support groups, and see if there are any specifically for men, if you think that they prefer that, because a lot of times men do prefer male-specific counseling. Before now, yeah. Try not to take their symptoms or lack of interest in you personally. A depressed friend may want to avoid phone and social contact and disconnect from your previously intimate bond. And it's a common heart temptation to internalize situations and blame ourselves for the way someone else is responding to us. This offense can often lead to feelings of rejection and worthlessness. Know your boundaries and your limits. It's so important to do that. and to not pour from an empty cup, because what good is an empty cup, you know what I mean? So it's so important for you to know your boundaries and know when to reach out for help for both of you, because it can really take a toll on you when you're helping someone with their mental health. Yeah, I believe that's it for today's video. Thumbs up and share if you enjoyed it. Click that subscribe button to join the Bingo Babe family. Comment below any tips you have for our men and their mental health. And most importantly, don't forget your garment of love, for it always protects, always trusts, always hopes, always forgives, and always perseveres. Have a beautiful day. Until the next video, shalom.